Hi guys, so I am going to do a hopefully quick video. I always say that and they end up being long, but a quick video about my journey with breastfeeding a baby with a tongue tie. I found out about 3.5 weeks ago at my baby's 4-month well child check that he had only gained a pound 7 ounces in the previous 2 months, and before that he had gained 4 pounds in 2 months. So from birth to about his 2-month checkup, he had gained 4 pounds, which was great. Breastfeeding was heaven. It was going wonderfully, and I was so looking forward to continuing it, and it was just going great. I noticed he was a little bit small, but he was born premature. He was 34 and 6, so 34 weeks, 6 days, but his birth weight was 5'11", so he wasn't terribly small. My older son was also a preemie at 32 weeks, born weighing 4 pounds 9 ounces. So I tend to have heavier preemies, but I thought that he was just kind of maybe on the little side. So I didn't pick up on the early cues. The first 2 months, the baby tends to coast on your milk supply, and so your milk is there, and usually it's a good supply, and you don't have any problems. Baby's pretty much just drinking what's falling into his mouth. It doesn't have to use a whole lot of accessory muscles or the tongue and things like that. So you don't really notice a problem in the beginning. I did notice a couple things now looking back that I have realized were sort of indications that he could have a problem, especially tongue tie, lip tie, or both. We noticed early on he would spit up a lot the first couple of months, and he was very gassy. My first son was not, and I just thought that because my husband has acid reflux and problems with that, that he passed it on to my second son. So that was one of the things. Another thing I noticed in the very beginning, the first couple of months, his tongue was always coated white, kind of a thick coating. And as a nurse myself, I used to wonder if he had thrush, which is a yeast infection of the mouth, easily treated, common in some babies. So I took him to the pediatrician. He didn't have thrush. So I thought, well, maybe my milk is just really fatty and it's sticking to his tongue and kind of coating his tongue. So I thought, that's great. Didn't think anything else about it. Now around 7 or 8 weeks, he started to sleep between 6 and 8 hours through the night, which was wonderful. And after feedings, he would feed for about 5 to 7 minutes, maybe 10 minutes, and occasionally 10, usually between 5 and 7 though, and be done. And so I thought I had an efficient nurser, a baby that just nursed very quickly and was very happy after 5 to 7 minutes. And again, he's my second child. I'm a pediatric nurse. I didn't really think much of all of these signs of what I now know to be tongue tie, lip tie, early indicators. There are many other sort of things that can be going on with your baby that could kind of make a lactation consultant, and even some pediatricians, but not most, red flags pop up. Another thing that we encountered was he would latch, and eventually towards the end of the 4th month, I guess it was, when my supply was very low and he really wasn't getting much at all, he would latch and then pop off almost right away. Latch and then pop off. So he was very, very fussy at the breast, and that was, like I said, right before his 4-month checkup. And so by then he had already not gotten very much for probably 6 to 8 weeks. Sometime after the 2nd month, that's when my supply really started to dip. I did have postpartum bleeding. I bled for about 3 months straight, no kidding, with maybe a day or two break here and there. That started at 7 weeks postpartum. And so it was a lot of things that happened, partly me with my bleeding. And against my better judgment, I started the mini pill, which my OB/GYN recommended to regulate the bleeding. It's the progesterone only pill, which is not supposed to affect milk supply. It did in my case, and it does in some women as well. So there are many factors that contributed to my dip in my supply and having low milk supply. But another factor, I think, and a big one, was that my baby just could not drain my breast sufficiently enough to stimulate my body to produce. It's a supply and demand system. So fast forward a little bit to his 4-month checkup, which was July 1st, about 3.5 weeks ago, and he was not even on the chart. Okay, so fast forward to the next day. My older one woke up and was screaming last night, so I had to stop the video and start again now, so I apologize about that. I was fast forwarding to Bentley's 4-month checkup, which I will go ahead and introduce him to you. Little guest appearance today. See, boy. We'll see how long he can hang out with us before he gets fussy. He just ate a little bit ago. So it'll be interesting to see how long he lasts. 4-month appointment, he had lost a lot of weight, and it was at that point I realized we had to do something. Now, I knew that part of the problem was my low milk supply. At that point, that's what I thought was the only problem, actually. So I immediately hooked up with Stacy, my lactation consultant in the area, and had a consult. We found out this was about a week and a half after his appointment, and she found a tongue tie. Now, I have a history of a lip tie that I had to have cut when I was like 11 or 12 to get braces put on. So I read they were genetic, and so that's something also to know. In case you didn't know, I found that to be interesting. So she found a tongue tie and said that could be another big contributing factor to his poor weight gain and my dip in supply. Basically, if the baby has a tongue tie or a lip tie or both, as they usually go hand in hand, it's very hard for them to empty the breast adequately enough or efficiently enough to not only meet their needs, but to stimulate your body and your breast to produce enough milk to continue having a good supply. So there were a lot of factors that helped to decrease my supply and cause him to have low weight gain. Once she found the tongue tie, I was faced with sort of a dilemma. Well, do I get it fixed or not? And it was a procedure. It's considered surgery. It was expensive up front, but we do get reimbursement from our insurance. Not all insurance companies cover it, though, and it's quite expensive, like I said. So there's a lot of factors to consider. Now, I've heard a lot of moms, and I've heard a lot of people in various groups that I'm in say that people have said, why would you put your baby through this just so you can breastfeed your baby? Why not just give your baby a bottle or just pump, exclusively pump and give your baby pumped breast milk? Well, I couldn't really pump and give him milk because it wouldn't be enough. So I could, but I would have to give him formula as well. Why not? So why not just give your baby formula? Well, breastfeeding, if there's a way to do it, for me, breastfeeding was my choice to feed both of my children, both of my boys. I wanted to breastfeed both of my boys for as long as they wanted to. And so to find out that I had low supply, but it can be worked on and increased, and with a lot of work, pumping after feeds, pumping at 3 a.m., power pumping at night when the kids go to bed. I mean, eight times a day I'm pumping, along with feeding him with the SNS. But like I said, with a lot of hard work, it can be done, hopefully. I'm you know, about a month in, and I've seen an increase in my supply, but I'm only producing about half of what he needs currently. So if there's another factor, and it's not just me, then that's sort of good because it's something that can be fixed. A tongue tie can be corrected, and that was what I had to decide if I wanted to do. Now, if tongue ties aren't corrected, tongue ties, lip ties, both, either or, if they're not corrected, then it's not just, oh, a baby can't feed or can't breastfeed, but they can bottle feed and they'll be fine. That's not always the case. If you don't correct them and they're severe enough, they can cause speech problems, problems eating, taking in solids when they're old enough to start taking in solids, and down the road, even, you know, some physicians wonder about apnea, which is where you have trouble breathing at night while you sleep. And so there's lots of considerations if you don't correct it early on. Your child may grow up and be just fine. So there's really it's a huge decision, and it weighs heavy on the parents, usually the mom, and just because she's the one who has to make the heartbreaking decision to do it or not. If she doesn't do it, there's, you know, the likelihood of successful breastfeeding kind of goes way down, and that's heartbreaking, but obviously you get over that eventually. And if you do decide to do it, it's heartbreaking because you're deciding to have surgery on your baby. However, you have to really, like I said before, there are benefits and risks to both, either doing it or not doing it. It's up to you what you decide. I'm just trying to share my journey with you and hope that you gather some educational information and also get a little insight into someone, you know, a real person's experience. So I did decide to go through with the procedure. I knew that I was working on everything on my end, and so it was time to work on his end. So yesterday, July 26th, we had the procedure. Dr. Wirtz has an office in Elizabeth City. She was there this week and was not back in Chesapeake. I couldn't see her in Chesapeake until, I believe, August 11th, which was about another month, and I didn't want to wait that long. I'd already been, you know, SNS feeding him 6 or more times a day, pumping, marathon pumping. I was exhausting myself to the point of giving up breastfeeding altogether and just saying, forget it, I'm done, I've tried everything. So I didn't want to wait another month. I chose to drive to Elizabeth City. It wasn't that far. It took me about an hour, maybe a little bit more. I got there at noon. We went back. Dr. Wirtz did her examination. She immediately caught his tongue tie. He has a middle tongue tie, which is, there's anterior and posterior are kind of the most common ones thrown around there. Anterior meaning towards the front of the tongue, posterior meaning towards the back. His is kind of right in the middle. He also has a very short frenulum, which is that small piece of tissue that connects your tongue to the bottom of your mouth, or your lip to your gums. And that's what's corrected during a lip tie, the frenulum, and it's corrected during both procedures, really. So his frenulum was short, and he also had a middle lip, a middle tongue tie. So he was very tight all around, though. If you can imagine all the muscles that you use to eat, to drink, to swallow, you use your cheeks, your chin, you know, your jaw, your everything to swallow and to drink and to eat. He wasn't using those, and so those muscles and those you know, organs properly. And so they were just pretty stiff. It's kind of like if you sit around after you break a leg and you don't use it for 2 months and then you try to walk on it, it's not like you're going to be just walking on your normal leg. You have to have physical therapy and do stretching exercises and do lots of different things to get it back to where it used to be. So in addition to having the procedure, now I have aftercare instructions that I have to do just to get his mouth and his tongue and his jaw and everything working properly as it should for a baby of his age, so that he can hopefully start nursing really well. So after she examined him, I gave her the okay to go ahead and do the procedure. Um, while she, or before she did it, actually, they called me back and asked me if there was a doctor there. I guess he was getting some dental work done, and I think he had overheard Bentley's case and how, I guess, quite severe his tie was, and was interested in watching the procedure. And so they asked me if I minded, and of course I said no, not at all. It's all for educational purposes. I don't mind at all if you watch. So, so he did. I waited in the waiting room for about 10 minutes, and then they called me back again, and there was Bentley, and he was in the nurse's arms. I can't remember if he was asleep at that point, but he was almost asleep. Now, they tend to be pretty sleepy after the procedure, and then the whole rest of the day as well. Now, today he's been fine. He's been up and playing, and he's been fine. He's been himself. But the day of, they're pretty sleepy. So I wasn't really sure how the first nursing session was going to go. Now, I did latch him on to the left side, which is my go-to side since I don't really produce much on the right. And he latched right away and nursed for about 8 minutes straight, which is more than he's done in a month, really. Because, as I've said, the only time he really nurses is one time in the morning around, 9 a.m. when it's been about 6 hours since I've pumped in the middle of the night, and I'm so full on the left side that he can actually latch well enough to feed and empty my breasts fairly efficiently and get a good feeding. So, but even that was starting to dwindle down about a week or so before the procedure. He started to not be able to do that even. So the fact that he latched on and stayed on, even though it had been, I pumped at 10 o'clock, so about 3 hours since I last emptied my breast, so it wasn't even near as full as it is at 6 a.m. or sorry, at 9 a.m. after 6 hours of no pumping and no breastfeeding. Even though it wasn't nearly that full, he latched on and stayed on and nursed for about 8 minutes on the left, which was fantastic. So I decided to switch him to the right just to see what he would do. I still want to, latch him on the right, nurse him on the right as often as I can to stimulate that side because there is milk there. It's, it does come out. I am able to pump it and hand express it. So then I need to be putting him on that side as well. The more stimulation, the better. The more demand, the more supply. We hope so. And he nursed on that side for about 5 minutes. So his total post-op nursing time was 13 minutes, but he was so sleepy. He was so tired that I'm surprised he went that long, actually. And he just fell asleep on the breast. So I kind of, I unlatched him and let him just rest on my chest and sleep. Dr. Wirtz came in about 15 minutes later to check on us, and by then we were done feeding. She went over the post-op instructions, which really are the stretching exercises, and that's the hardest part for moms or anybody doing it. It's kind of where you have to lift the tongue up to the roof of the mouth, hold it, and then repeat. And then you sort of swish your finger around where the wound is. It's like it's a diamond-shaped wound under the tongue. You can see it plain as day when you lift the tongue up. And what you're doing is sort of like a rolling pen motion, and there's several different exercises, but the goal is to not let it heal back over. If it heals back together, the whole process needs to be repeated, so we don't want that to happen. I have to do these stretching exercises 5 times a day for the next 6 weeks to prevent it from healing over and growing back into place. So that's a big deal, obviously, for me and for any caregiver, so that's a big thing to consider. If you have a newborn that gets it done, it would be pretty easy to do that since you probably won't be going back to work until after your 12 weeks is up, if that's your situation. For me, like I said, I was getting ready to go back to work, but when all this happened, I put that on hold. I would still like to go back, but we would just have to figure out, if I go to work in the evenings, is my husband comfortable enough to do the exercises? I'm pretty sure he would be, especially with me showing him how. But you have to make sure that if you're not there to do it, someone else is, 5 times a day for 6 weeks. It's very, very important. Um, there was no bleeding. It's normal to have a yellow or whitish sort of presence there under the tongue, and I think the lip as well. I don't really know much about the lip because he didn't have that done, so I'll just mostly talk about the tongue part. But if you see anything of another color or bleeding or anything like that, then you would contact her and let her know. But he's been, like I said, completely, totally fine. Now, as far as yesterday, so the big deal yesterday was he went, and actually still is, his last formula, bottle of formula, was at 8 o'clock at night on Monday night. So it's 1:45 on Wednesday, so he's almost, hopefully I can get him to 48 hours without having the formula and just breast milk, which would be amazing. But he has gone at least a day and a half without it. So even that is a lot of progress since a month ago, or in the past few weeks, rather. Now, as far as the SNS, I didn't use it at all yesterday. I didn't use it once. We breastfed 2 more times yesterday evening after coming home, and then in the evening he got a bottle of breast milk before bed, and then he also got a bottle in the middle of the night of breast milk. He wakes up around 4 or 5 and gets pumped milk. Ideally, sometimes it's formula, but last night it was pumped milk. So that's great. I haven't used the SNS today yet either. I have so far, I nursed him this morning. I had that nice full breast around 7:30 this morning, and that was after pumping at 2, so about 5.5 hours, which is my norm. So it was pretty full. He nursed for about a good 15 to 20 minutes and was really full. And I even put him on the right just to top him off and also to stimulate that side, like I said. I can't really tell a significant change in the suck. I can tell it's stronger when I try to pull his pacifier out of his mouth, but I can't really tell it's a stronger suck when he's latched on and nursing. And when he's nursing, I don't really notice like a stronger, nursing feeling, I guess. But that will probably come in time the more these muscles are loosened and everything, and the more exercises we start to do, like I was talking about before, how tight he is. So that will probably come later, and every baby's different, and so you may have a different experience. I've heard lots of moms say that the first latch or the first feeding post-op is a world of difference, and it just feels completely different in a good way. So, but that's just what happened with me and what's been going on with Bentley. So, and today so far, like I was saying, he nursed this morning like he normally does, and then around 10:30 or 11 he was hungry again, but I had pumped, and I was sort of going to continue my norm where I pump in between feedings. So I pumped about 9 a.m., which was about an hour and a half after he ate, and so by 10:30, 11 o'clock, I really wasn't full and didn't have a lot of milk there. So when he latched, he got frustrated. He wasn't getting let down quick enough, and so he kept popping off. And so I tried the right, and same thing. So total, it was about maybe 5 minutes nursing. So we stopped, and I ended up giving him a bottle of milk that I had pumped, breast milk, and that was just now. So far today, we have successfully nursed a great deal of time once. We attempted to nurse again, and it didn't go so well, but I think that was my fault because I pumped. And so he did get a bottle of breast milk. But so far, still no formula and still no SNS. Now, that's not to say he doesn't need the SNS or he doesn't still need supplements. He may very well need supplementation for a little while longer. We don't know. We have to watch his weight. So we'll know by weight, and also on a daily basis, I'll know by his wet diapers. I need to make sure he's having enough wet diapers and pooping enough, and just that he's not acting hungry, that he's not really fussy and everything. So those are the main things that you want to watch out for as far as weaning off the SNS and all that, I won't get into in this video because I see Stacy tomorrow, and hopefully we'll come up with a plan to wean down the SNS. I've already not, I've already stopped using it, but that doesn't mean that he won't still need extra supplementation until my milk, my supply is even more, because like I said, it's probably at about 50% of its norm right now. So he still needs more, obviously. And the pumping is helping so that you can get bottles in the middle of the night, or just during the day. But I do want to say, and I do plan to ask her this tomorrow, I was pumping in between feeds to increase my supply, to help increase my supply. However, I'm wondering if I don't pump in between feeds and I just pump either right after for maybe 5 or 10 minutes, and then just pump at night, my power pump sessions, and then also at 3 a.m. If I do that as opposed to pumping in between, I'm hoping what will happen is he normally goes about 3 to 4 hours in between feedings. So if I can get a 4-hour full breast in his mouth, maybe he'll latch on and be able to feed, as opposed to, feeding him and then 2 hours later pumping, and then an hour or two later he's hungry. Well, I'm pretty much empty after pumping. So that's something that kind of hit me earlier after I tried to nurse him. I thought, well, he's not going to nurse because I pumped an hour and a half earlier. So I'm going to talk to Stacy about that tomorrow, and I'll make a follow-up video tomorrow after I meet with her about recommendations for supplementation, and also pumping. If I just pump, for some women just do 5 or 10 minutes right after the baby finishes feeding, just to stimulate your body to continue to produce milk. It kind of tricks your body into making more milk because your body thinks your baby's still feeding and needs that milk. And then waiting until his next feeding to feed him so that my breasts are full. And that will help, especially in the beginning, I think, until all of this is loosened up and we've done some work, and babies have to learn how to suck again and how to breastfeed again once they are released, once their tongues and lips are released. So baby steps, this is day 1, but I did want to do a quick video just to let you know how it went. I'm very happy so far. I would do it again in a heartbeat. He's happy, he's fine. He hates the exercises, but they have to be done, of course. I did give him some Tylenol for pain twice yesterday, but that's it. I haven't given him any today. He hasn't needed it. And they also give you some Highlands teething gel, which I have used. You can use it, I think, 2 to 3 times a day. And I've used it, I put it on my finger as I'm doing the exercises so that it numbs it, so that afterwards, if he's sore after the stretch exercises, that the numbing gel can hopefully help with that. So I'll try to make a video as well of these stretch exercises, because I tried to find some online and they were pretty confusing and just not helpful. And so I'll try to make a video of that one day soon. And I'll make another one tomorrow, hopefully, after I meet with Stacy and have an updated plan. But so far, everything's great. The procedure went well. I would do it again, like I said, in a heartbeat, and I'm so glad I made the decision to do it, and that I trusted my intuition, and that I did my research and made an informed decision, which is what I encourage you to do as well. Hopefully this video has helped you. Please feel free to reach out to me, like I always say. If you have questions for me personally, or if you want to share your own experience, I'd love to hear about it. Especially if your baby has, tongue tie, low weight gain, and you have low milk supply, just like me. That'd be wonderful. But I will catch you guys soon, hopefully in another video that is quieter and can be done in one session instead of multiple. So thank you for watching.